We're sorry, but we're getting a sound that is not sufficient for the interpretation. There are problems with the connection. I'd like to start with this slide. In the European countries, we have an 18% from moderate to intense. In 12% of these cases, we entail that this is more than 10% of prevalence. This is a symptomatology that is catastrophic. This type of patients suffer a lot, and they have a pharmacology which is very wide to palliate this type of symptom that they're suffering. And on the other hand, we have fibromyalgia as a syndrome that is associated with chronic pain, generalized chronic pain, and besides, it normally is connected with other labels, such as chronic fatigue, apart from an important diversity of symptoms that we will see soon. With fibromyalgia, only in our country, in Spain, the range varies normally from ranges of 0.5%, 0.4%, which is not significant, to up to almost 10% of the population. And as an average, the range of this disease or syndrome is 2.5%. This is between 700,000 and 1 million people, which is a very important figure. We have to take this into consideration when providing primary care, clinical care, and all kinds of interaction with the patient. We have to be open to having one of these cases. For 11 years, we have been treating these patients, and we have also seen.
And these women say that in spite of having this fibromyalgia diagnosis, which is very much delayed, when they have this symptomatology, when they reach the clinic and when they give them this label of, this is fibromyalgia, there are other symptoms that are very common, and they are quite catastrophic for their quality of life. We've been working with the Association of Fibromyalgia in Madrid, where there have been clinical trials. We have this experience of working with them and joining our knowledge in histamine in relation to this pathology. And part of this of the clinical diagnosis criteria, and for more than 30 years, there's been different consensus in the diagnosis of the disease or the syndrome. We're sorry, but we're having trouble with the reception of the sound for the translation. For a long time, it's a pathology to which patients go to the different areas like neurology, traumatology, rheumatology, and then each one of them have their own vision, their own criteria, and this makes it. Yes, okay, as I said, in Spain, we have the 2010 consensus, and we have the American Society of Pain 2019, and all of these not only associated to fibromyalgia but chronic pain, like other entities like chronic fatigue or chronic fatigue. And the one we have in Spain, which is the one you have in the image, there you have some symptoms that they establish as very prevalent or with different prevalence percentages with this fibromyalgia patients. And pain is also in 100% of the patients, but there are other symptoms like exhaustion, sleeping disorders, and that is to say the majority of patients suffer from this chronic fatigue syndrome and exhaustion, also alteration or insomnia or alteration of the sleeping cycles. And other prevalent symptomatology would be digestive pathologies. What they call this irritable bowel syndrome. That's prevalent over 70%. But other symptoms migraines up to 40%. And other symptoms up to 50%. We're not receiving the sound properly. We apologize for that. And like symptoms associated so that we can see it easily, like muscle pains, memory-related pains, nausea, diarrhea, depression, reflux, etc. And many of the ones that appear here on the slide. You can guess this is all very similar to what we've been listening to in the presentations of this conference. The symptoms produced by this DAO deficit. And I allowed myself to do this link. To the left, you have this symptomatology. The central nervous system, respiratory system. So in each one of digestive systems, so in each one of those systems that are part of the organism, we would have some fibromyalgia affections, and at the level of DAO deficiency, we would have virtually the same symptoms. So this leads us somehow to think, could DAO deficit a marker in the pathology of fibromyalgia? And if that was so, and even if we do not give an answer to this question, could we use the approach of the treatment used for this histaminosis or a DAO deficit? So introducing exogenous DAO to patients that suffer from fibromyalgia? For us, the answer would be yes. So this is something that we've seen in our experience and research on the different pathways that would be related in this sense. So then we would see that a level of low degree inflammation, for example, the effects done by histamine as a neuroregulation, neuroinflammation, the activation of nociceptors or pain receptors, and the actin, as we said in the previous speech, of histamine as a neurotransmitter, and as we said before, the capacity of microbiota, intestinal prevalence in the production through this way of histamine and having an influence into its regulation. This inflammation would affect this neuroregulation and the microbiota of the intestine. And at the neuronal level, we could regulate the border, and we would have this connection together with the information on the neuronal part.
With low-grade inflammation, in this slide, we have a mechanism in the level of the inflammation that may produce bacteria such as polysaccharides that would generate an endotoxemia in this microbiota. And in itself, inflammation is widely studied and enhanced in the studies with fibromyalgia patients per se, in the same tissue and in nociceptors of pain. In neuroregulation, we should highlight that just as other neurotransmitters, adrenaline, cortisol, etc., will have an influence in the fibromyalgia patients on the one hand, these neurotransmitters or these factors, such as emotional ones, for instance, such as stress, anxiety, depression, etc., that, as I said at the beginning, are symptoms that are quite prevalent and associated to the pathology of fibromyalgia, we see that these factors are associated with a bigger liberation of endogenous histamine, because this is a deregulated form. All this is going to have an influence, apart from the microbiota, as in the previous presentation, infections, bacterial problems, prevalence of different types of bacteria, or specific bacteria that are carrying certain elements that would produce an enhancement in the possibility of having histidine, and definitely are going to produce histamine in themselves, and this is going to bring about an increase of histamine, systemic histamine. As it was mentioned earlier in the morning, there is an increasingly bigger connection of digestive pathology. For instance, gastrointestinal disease, what is damaged or altered, enterocytes, for instance. And this is obviously one of the relevant elements to understand where the problem is with the DAO deficit. It is precisely there where the enzyme is synthesized to generate this amount of histamine that is taken exogenously with the foods. The fact that we have a permeated intestine or not, this may suggest that this area is not so efficient when synthesizing this enzyme, the DAO enzyme. Arterial problems that have not been diagnosed, infections, etc. We have clearly described that histamine can alter the inflammation in the receptor through the TLR, and in some fashion this may increase, on the one hand, the permeated intestine and the inflammatory cascade. This study was published in 2020. It is interesting because it connects histamine and its receptors with neuropathic pain. It's quite graphic, and I'll leave it here so that you can take a look at it. You can see in receptors 1 to 3 of histamine how they are affected by the pain. And when we focus on histamine and fibromyalgia, we can see different studies that we can understand as possible candidates for ways and mechanisms that are directly involved with fibromyalgia, with pain, with muscular problems, osteoarticularly, etc. All these elements are there, and they are the ones that may be seen in the clinic aspects with the patients and symptomatology. Whether knowing where the mechanism may be, or the set of mechanisms that we are handling, if we have a genetic deficit, if we have an exaggerated liberation of endogenous histamine, if we have alterations in the border, etc. So this deficit could be secondary to a primary pathology if we have problems in the metabolism, in the blocking, for instance, or if there is these other parts of the microbiota. This has also been referred to. So we have this vision of how we can have a patient with a symptomatology that is absolutely compatible with a DAO deficit, DOA deficit, and if we see that there is an alteration of histamine for any of the pathways that we have seen, then it is interesting to check whether we want to assess the treatment with exogenous DOA, with histamine, that is complete from a nutritional perspective. So the conclusions are that there is a strong connection at a molecular and physiological level that relates with the fact that there may be a relationship between the both factors. Treatment with exogenous DO and a low histamine diet can be a powerful therapeutic strategy. We have extensive empirical experience, more than 5 years, working in this line with satisfactory results. However, more studies are needed to assess the prevalence of DAO deficiency in fibromyalgia. And of course, in the second line of study, to explore the mechanisms involved in the possible therapeutic approach. It would be a therapeutical focus. I also have the honor to announce that in this regard, thanks to the support of both sponsors, we are going to lead a trial, a clinical trial on this regard. And that's all for the moment from me. Thank you very much.